So the next 2-mark question is, any two muscles supplied by axillary nerve. Any two muscles supplied by axillary nerve. You can take a sentence here. Art teacher diploma. ATD. This A stands for axillary nerve, T stands for teres minor muscle, and D stands for deltoid muscle. So the axillary nerve is supplied by auxiliary nerve supplies to the teres minor and the deltoid muscle. So this is the answer. And these you can create your own tricks. You can create. No need to run with the tricks which I am providing you. You can create all these things. I just put in my book. I completed the 2 books of anatomy, paper first and paper second, and within short period, due to this corona, it was little obstruction, but within short period, Bijan publication from Pune, from Delhi is going to publish both the books. And those books are with, you can say, 2-mark questions, chapter-wise 2-mark questions, chapter-wise 5-mark questions, chapter-wise 10-mark questions, and chapter-wise 20-mark questions. So that is a guide for you. It will help with the question and the systematic way of presenting the answers. Next question. Any two muscles supplied by musculocutaneous nerve. What is musculocutaneous nerve? You can remember BBC News. What's famous news channel? BBC News. So from this BBC News, you can take BBC. 1 B stands for bicipital. Second B stands for brachialis, and third is for coracobrachialis. So these are 3 muscles supplied by musculocutaneous nerve. The next, name any 2 rotator cuff muscles. Name any 2 rotator cuff muscles, and for this a word sits. SITS is useful, and take each and every that S, I, T and S from the words sits. Now this S stands for supraspinatus, I stand for infraspinatus, C stand for teres minor, and again the next S stand for subscapularis muscle. So these are the 4 muscles which are the muscles of rotator cuff. Now the next 2 muscles supplied by radial nerve. So to remember the radial nerve, you just remember the word best. So the muscles supplied by radial nerve are B, E, S and T. This B stands for brachioradialis. B stands for brachioradialis. E stands for extensors. S stands for supinator, and your T stands for triceps. Brachioradialis, extensors, supinator and triceps. These are 4 muscles which are supplied by radial nerve. Let me talk a little apart from this. Friends, there are 2 groups of muscles for the forearm. One is flexor and one is extensor group. One is flexor group and one is extensor group. So the flexor group are taking origin from medial side. Do you know FM radio? FM Mirchi and FM 94.5 and all we are listening. So this FM, you can take the FM to remember which side is giving origin to which group of muscle. So F flexor, M medial. So medial part, rather you can say medial condyle, medial part give origin to the flexor muscles. The flexor muscles, and the lateral part gives origin to the extensor muscles. So again coming with the radial nerve. So radial nerve supplies 4 muscles, and those are the best muscles. 4 best muscles are brachioradialis, supinator, your extensors, and lastly the triceps. Next question is muscles responsible for flexion of elbow. Muscles responsible for flexion of elbow, and for the flexion of elbow there are 3B. There are 3B for the flexion of elbow, means muscles having the name with the B. They are the flexors of elbow, and those are brachialis, bicep brachii, and brachioradialis. 1B brachialis, 2nd B bicep brachii, and 3rd B is brachioradialis. So these are the 3 muscles which are the muscles responsible for flexion of elbow joint. Now the next question is muscles attached near the bicipital groove, and we all are knowing, it is good many times talked in the class about the sentence a lady between 2 measures. A lady between 2 measures. So this is the sentence to remember. The muscles attached near the bicipital groove, and a lady is for latissimus dorsi, and 2 measures are, one is teres major and one is pectoralis major. So these are the 3 muscles centrally placed at latissimus dorsi, and by the side 2 measures, one is teres major and one is pectoralis major. So your answer is, following are the muscles attached near the bicipital groove. One is teres major, which is attached to the middle lip of the groove. One is pectoralis major, which is attached with the lateral lip of the groove. And third one is the latissimus dorsi, which is attached at the floor of the groove. About the muscles of shoulder joint. Shoulder joint has good many movements, and shoulder joint for 20 mark questions, and even the 2 mark question from the shoulder joint regarding the movements is possible to be in the examination. And all the muscles and their functions with the story of the shoulder joint was already explained by me in my previous video about the anatomy of shoulder joint. It is wise for you to go and watch the video, and you will surely remember all the muscles with their functions of the shoulder joint. So now the next question is, what are the contents of carotid sheath? So the carotid sheath contains, we know carotid sheath, it is a covering of the carotid artery which is passing through the carotid canal of the neck. So carotid sheath, contents of the carotid sheath can be remembered with the sentence, I see 10 cc dextrose in IV. I see 10 cc dextrose in IV. So from this sentence, take I, internal carotid artery. Take 10th, that is 10th cranial nerve, and which is 10th cranial nerve? Vagus. Take C for the common carotid artery, and lastly take I, that is internal jugular vein. So these are the contents. These are the contents of carotid sheath. The same is applicable for the carotid triangle. Same logic, because carotid sheath is in the triangle. So the same logic is applicable for the carotid triangle, and the contents of carotid triangle are same: internal carotid artery, number 2 your 10th cranial nerve, that is vagus, number 3 your common carotid artery, and number 4 a part of internal jugular vein. Now the next question is, any 2 symptoms of Bell's palsy. Any 2 symptoms of Bell's palsy. Symptoms of what? Bell's palsy. Now catch the word Bell's palsy. These 2 words, one is Bell's and second one is palsy. Now from this you can from Bales you captured all 5, and from palsy just consider one, that is P. So B, E, L, S and T are the things to be considered. 1B stands for blink reflex abnormal. Blink reflex abnormal is 1. Second one is erect, E, B, E. Second one is erect. Third one is lacrimation, as it is a paralysis of facial nerve. Third one is lacrimation. Fourth one is loss of taste. And your S for sudden onset of the symptoms. And lastly the P for paralysis of facial nerve. So you can put the answer in this way. Bell's palsy is a entity occurred due to the paralysis of facial nerve, showing the following symptoms. Number 1, blink reflex abnormal, or you can say there is abnormal blink reflex. Number 2, there is erect. Number 3, there is lacrimation, and number 4, there is loss of taste. So this is about the Bell's palsy. The next 2 mark question is any 2 contents of superior mediastinum. For this you can remember a sentence: keep bats intact. We are playing the cricket and finally your captain ordered, oh no, match is finished. No, yes, you are supposed to keep the bats intact. So to remember the contents of superior mediastinum, you can take help of the sentence keep bats intact. And now take 2 words from this sentence: bats, B-A-T-S, and second word is T-E-N-T, that is tent. Keep bats intact. So now separate the bats. B stands for brachiocephalic vein. Your A stands for arch of aorta. Your T stands for thymus. Your S stands for superior vena cava. Bats. B stands for brachiocephalic vein. Your A stands for arch of aorta. Your T stands for thymus, and your S stands for superior vena cava. Now the tents. Tent, T-E-N-T. So from tent, the T stands for trachea, E stands for esophagus, not esophagus, esophagus. Your N stands for the nerves. There are two. One is vagus and second is the branch of vagus, that is phrenic, and fourth, that T for thoracic duct. So these are the contents of superior mediastinum. You can say superior mediastinum contents: brachiocephalic vein, your arch of aorta, PAT, your T for thymus, S superior vena cava, then T for trachea, then E for esophagus, then N for the nerves. There are 2 nerves, one is vagus nerve and second is phrenic nerve, and lastly the T, that is for the thoracic duct. So these are the contents of, and if you are writing all these contents, actually it creates a best impression and it will take very short time. Okay? Your question is name the muscles in the floor of cubital fossa, and for that you are supposed to remember Bachelor of Science basic, a graduate course. BSc is to remember the muscles which are at the floor of cubital fossa, and that BSc stand for, one B stand for brachialis, your S stand for supinator, and your C stand for cubital fossa. So these two muscles, one is brachialis and second one is supinator, are forming the floor of cubital fossa. Friends, there are near about 150 2-mark questions which I covered, and out of those I just presented few of the questions, and this is the hint for you that you can create your own tips and you can exert at your own level so that it will become easy for you to score maximum in relation with MCQs. And already told, if you are capturing 20 marks in the MCQ with the proper answers and you are getting 15, near about 15 marks in the last question among 5, 6, 7, then the remaining second, third and fourth you can obtain and you can score the passing score. Thanks for observing the video, and we will continue with the decided plan of the facial nerve, and then I will proceed with the triangles of the neck, and rather I am also thinking to have a video on your brain stem in a simple and easy way. Hope you enjoyed today's video.